India was one of the hardest hit countries by the pandemic. In the spring of 2021, overwhelmed hospitals had to turn COVID-19 patients away, often leaving them to suffocate from lack of oxygen. Several months later, the vaccination drive is in full swing. On Tuesday, only around 14,300 new COVID cases were reported. It's the lowest single-day rise in nearly 8 months. But is the trend at risk now that the festival season is underway? COVID is definitely still here. People are under the false impression that COVID is over, but it's still going on. Health experts fear that India's popular festivals could turn into superspreader events and that history could repeat itself. Welcome to our COVID-19 special. I'm Monica Jones. Good to have you with us. Durga Puja, the biggest celebration of the year for those of Bengali heritage, is underway amid ongoing COVID-19 restrictions. Attendees are required to tread carefully, maintaining a distance from each other and from the extraordinary works of art and decoration, because nobody wants the festival to kickstart another third wave.
It has been hectic, almost non-stop inside the structures that dot this part of Kolkata in India's West Bengal state. But the work is winding down as artists put the finishing touches on idols of the goddess Durga and other deities. This will again be the event of the year here, the Durga Puja. Normally, it's a wildly busy week of art, culture, food, and crowds. Despite this huge banner, there will be strict limitations for the second year running on access to the fabled pandals, the temporary structures where the goddess is housed. Authorities are worried if they went unrestricted, it could be a coronavirus superspreader event. This festival director says this is one of the top art events in the world, but authorities insist most festival goers will not be allowed within 25 feet of the artworks. On the street, masks are the rule. Volunteers are handing them out, and you'd better put one on if you're on camera. And especially if you're stopped by police. The vaccination rate in these parts is estimated at over 60% for those receiving 2 doses. And vaccination drives are aiming to bring up numbers ahead of the Durga Puja. Artists and festival workers are forging ahead as though it's any other year.
Well, sadly, it's not like any other year, which is why getting that life-saving shot can make all the difference. But for many Indians, that's easier said than done.
It takes a lot of patience. In West Bengal, vaccines are still rare. For people in cities like Siliguri, it means queuing all night. See, we've brought food along. We came here in the evening and they will hopefully vaccinate us in the morning. What can we do? It's really distressing. We leave our kids at home and come here. We have to go through so much to get vaccinated. Prime Minister Modi wants 950 million people to get their first dose by the end of the year. India is on course to achieve this goal, but for those living in rural areas, getting that life-saving shot often remains a dream.
Dr. Rajib Das Gupta joins us now from Delhi, where he's the chairperson of the Center of Social Medicine and Community Health at Jawaharlal Nehru University. It's very good to have you with us. And starting straight away with the topic of vaccination, we heard that the vaccination rate in Bengal is about 60%. That is not bad. How does this compare, though, to other parts of India?
Thank you. And first, Durga Puja greetings from Bengali, though not in Bengal at the moment. Yes, West Bengal's immunization coverage has certainly been better than many of the states. And more importantly and interestingly, the gender advantage has been in favor of women rather than men, which is true for most of the country on an average. However, as you very rightly said, that mass events, mass congregations, whether of religious or political or any nature, are certainly a risk at this point. But it's also to be taken into account, along with India's high seroprevalence rate, which is near about 80% going by the last round, and that could be a blessing in disguise.
And of course, as far as I understand now, there's also a vaccine approved for kids now. How big a difference will this make for all those festivals coming up?
Well, it's only in the emergency authorization stage. It's quite a distance from what was announced today, the second vaccine to be approved, to an actual rollout to a vaccination program for kids. That's quite a bit of a journey, but certainly it was a good news today, and there's a lot of optimism, particularly as far as children and adolescents go.
Okay, so there's light at the end of the tunnel there too. But how worried are you that this festival of Durga Puja could eventually be a corona superspreader event?
Well, actually, we don't know. It's going to be an interaction of two things. One, pretty high seroprevalence, which is on account of a combination of two things: a reasonably good vaccination coverage till this point, particularly in urban areas, plus immunity post the Delta tsunami that we had, which of course came with its share of very high levels of mortality in some parts. But the two put together actually means that a substantial proportion of the population is protected. But what's worrying is that India currently has the largest numbers of those individuals immunized with a single vaccine, that's partially immunized population. That in itself is potentially worrisome, plus the crowds, of course.
Worrisome because it could promote mutants, or worrisome why? Because the protection is not that accorded by 2 doses of the vaccine. A very large proportion is still partially immunized. Not so much because a mutant would arise in a very short time, but yes, if transmission goes on, the probability of a mutant emerging does remain theoretically possible. Now, you've already mentioned the devastation of the second wave. How well prepared is the health sector now? Well, we all think that the health sector is much better prepared now. I'm sure that across states, both state governments and federal governments, as well as the private sector, have taken a range of measures. A lot of learning has happened, and I hope we should be able to cope better. But personally, I do not really expect another wave of that magnitude unless something dramatically different happens. Like those big festivals, which are extremely traditional, obviously, and very important in India. Do you think it's feasible to say, let's just cancel those festivals until the pandemic is over, or is that completely impossible? No, the trend so far has been both on parts of governments as well as the courts, who have often stepped in to issue a range of advisories. Now, some of those advisories are often followed very strictly, particularly last year it was. This year, for example, in West Bengal, it comes with a set of caveats, do's and don'ts, some of which may not actually be very conducive to being implemented in letter and spirit. Okay. Dr. Rajib Das Gupta, thank you so much. And Durga Puja, greetings to you as well. Thank you very much. Time now for one of your questions, and over to our correspondent, Derek Williams.
What is the Mu variant?
SARS-CoV-2 is mutating all the time, and although the vast majority of those genetic changes give rise to variants that disappear quickly because they're just less competitive than the variants that currently dominate the COVID landscape, a few change in ways that might make them more competitive or more dangerous. New variants are identified by sequencing their genomes and comparing those genomes to earlier versions of the virus genome. when a new variant appears to be spreading rapidly in a particular country or more widely, healthcare authorities, like at the WHO, start to track it, and it can become what's called a variant of interest. The B1621 variant, also designated Mu, was first detected in Colombia back in January. It became quite prevalent there, and it's since been involved in outbreaks in other parts of South America and Europe and the US. Mu was designated as a variant of interest at the end of August. The WHO added it to that category because of concerns that it might be able to better get around COVID-19 vaccines and current treatments. There were some indications that it could be better at that than the highly transmissible Delta variant, which is affecting so many countries at the moment. However, for now at least, worries about Mu really taking off are dropping. Numbers of confirmed cases caused by the variant have fallen in many places, which a lot of experts think is because it's being simply outperformed by Delta. So while it's still being watched carefully, fears about Mu have eased, at least for the moment.
And before we let you go, people in Sydney are enjoying the first days of return freedoms as the city ends its 106-day pandemic restrictions. We are back and we are open. Sydney's cafes and restaurants welcome back fully vaccinated customers on Monday after nearly 4 months of lockdown. As Australia's vaccination rollout gains momentum, authorities say it's time to live alongside the virus and reopen. That's all for now. Thanks for watching.